A billing scheme costing taxpayer billions of dollars now getting the attention from federal leaders. Investigative reporter James Stratton first uncovered the issue weeks ago.
Medicare paying for catheters that no one wanted. Tonight, James Stratton reports on members of Congress looking for answers.
The nursing is with the pin.
Staring back through the photos.
I'm very proud. 50 years.
Is a longtime caregiver. The still registered nurse, now retired, always believed in one thing.
I always believed in safety for my patients. That's so important to make sure that they're always safe when they're in a hospital environment.
Now, Mary Kogelman says the safety that she wants for herself is gone.
It added up to the $1,133.67.
The more than $1,000 charge showed up on her quarterly Medicare statement, $1,133.67 for catheters she didn't want and didn't receive. She's one of the more than 80 people 12 News Investigates has talked to caught in the same situation.
You never requested the catheters?
No.
2 shipments of catheters that I did not order.
It upsets me every time I see it.
The billing scheme 12 News Investigates first uncovered is now estimated to be between $2 and $3 billion. A group of Republican congressional members, though none from Wisconsin, are asking for answers. They requested closed-door meetings with the leader of the Center of Medicare and Medicaid Services, Shakita Brooks LaSure, and the Department of Health and Human Services Inspector General, Christy Grimm. The letter to the pair says more than 450,000 people on Medicare are caught in the middle of this, quote, significant failure. It questions the current fraud detection and prevention and says it, quote, should have been quickly identified and addressed. They want to know when CMS and OIG first knew about the fraud, what they did to stop it, and what they've learned.
Earlier this year, several intermittent catheter companies were found to have engaged in fraudulent activities, deceiving both Medicare and patients.
After months of asking lawmakers if Congress should investigate, a subcommittee of the Energy and Commerce Committee held a hearing about improper payments. Representative Marionette Miller Meeks of Iowa asked HHS Inspector General Christy Grimm specifically about catheters.
Can you please highlight what CMS is doing to ensure fraudulent players are identified early and prevented from participating in the program?
Grimm wouldn't specifically comment on the fraud scheme.
I can tell you that we monitor claims data. When we see a spike in billing, we immediately move to investigate.
From her kitchen table, Kogelman asks the same questions that lawmakers want answered.
I think this is a disservice to a lot of elderly, and I don't want to see it continue. Like I said, they need a safety valve at Medicare, and I don't see where that's happening. Every business needs a safety valve.
The safety valve is theoretically Congress.
Yes.
It's hard to find somebody in Congress who's willing to step up to the plate and do something about this.
Jeff Leston owns Castlestone LLC, a company specializing in stopping healthcare billing fraud by using two-factor authentication, a text or a call asking the person if it's really them authorizing the charge.
Just like you see with a bank, did you tip somebody $300, yes or no? We have the ability to send that to somebody's cell phone and say, were you at such and such dermatology, yes or no?
Leston's company pitched the project in the durable medical equipment field of Medicare, where the catheter fraud ran rampant, but was never implemented. Instead, Medicare sends people these statements quarterly, which means at best, someone won't catch the fraud until 3 months after it happened.
Medicare is basically asking you to catch fraud that you don't even know is happening.
Correct.
Until it's
too late.
For most, their statements show Medicare paid thousands on their behalf, all for catheters they didn't want or receive, including the nurse of 50 years who watches her statements as closely as she watched her patients for decades.
James, every time you report on this issue, we can hear the frustration. Now the federal government is warning seniors about this scam.
And that alert was sent weeks after we started reporting on the issue. It says seniors are targeted by phone calls and texts with offers of free services. Then scammers use their personal information to order the catheters. But of the more than 80 people that we've talked to, the same number who've talked to the state, none report a targeted phone call or text, which begs the question how their Medicare number was caught in this scam, and so many of them on top of that.
Yeah, question after question. James Stratton, thank you.